I'm Dr. Durkin. I want to talk to you guys today about blepharitis. Blepharitis is a condition where the eyelids get irritated. Sometimes they get red, or they can feel gritty or scratchy or dry. It's often caused by, it could be due to allergies or maybe to some inflammatory debris from bacteria that live on the skin surface. They can overgrow in the oils and skin cells on the surface of the lids and make your eyes feel really uncomfortable. Uh, Oftentimes what we'll get is the little oil glands have openings right at the edge of the eyelid. So if you were looking at the lid and it's flat up against the eye, they're like literally right behind the eyelashes. And those can get clogged up, and the oils can get thickened and get like stiffer and not quite as flow nicely. And the normal skin bacteria that live on the surface of our eyes will overgrow there and cause some chemicals to be produced that kind of make an irritated feeling, kind of like when you get soap in your eye, or if you're sweating and the sweat drips in your eyes, kind of that burning sensation. So we can use different techniques to try to help with that. One of the easiest ones is to use warm compresses on the lids to warm up the oils to help them flow better, and then apply some pressure to the lower lid or the upper lid like this to kind of push and squeeze the oils that are hardened from the oil glands out through those openings on the surface. Then you do the top one, you kind of push down from the top down. You're kind of trying to squeeze them like a tube of toothpaste from the base down towards the edge of the lid. And it kind of feels funny because you're pushing up against your eye, but there's really nothing else you can push against. So you just kind of have to do that. And you don't want to do it for too long. I would say maybe 5 or 10 seconds in each position. Then we can use some pre-moistened lid wipes. There's different brands out there, Systane, there's AccuSoft, there's other brands that you can find at the drugstore. And you can use those to cleanse the lid margin. So with your eyes closed, you would use one of these pre-moistened wipes and just kind of rub back and forth along the lids and try to get any of the built up oils and skin cells and debris from around the base of the eyelashes and remove that. That can help quite a bit, and that's something you can do every day. Probably once a day is enough for most people. If your eyes are really bothering you, you might do it twice a day for the first week or so. You don't want to get too aggressive because some people's eyes get irritated just from manipulating the lids too much. So then for people that have more severe reactions where they're getting a lot of redness, a lot of discomfort, we'll often temporarily use a steroid and antibiotic combination drop that can suppress some of the inflammation and help your eye feel better and look better, but also reduce some of the bacterial populations on the skin and allow your eye to kind of heal and come back to normal. After a week or two of that, we'll want to stop that and just do the more conservative treatment like with the lid scrubs. There's also some chlorine-based cleansers that you can use on the skin. One of them is called Avenova. It's a spray. It comes in a little bottle, and it smells kind of like pool water, like when you go swimming, but it's very gentle to the surface of the eye, so you don't really feel anything when you spray it on there. But it also helps to reduce the level of bacteria on the skin surface and helps to get rid of some of the oil buildup and things like that. And that's another thing that's safe to use for every day, once or twice a day if you need it. So one of the things we can do as a nutritional supplement to help with the oil glands is to increase the amount of omega-3 oils you get in your diet. Fish oil and flaxseed oil are the common ones that are sold over the counter. And usually probably like 2,000 to 3,000 milligrams of fish oil daily seems to have some benefit in the long-term health of those oil glands. It's not necessarily going to cure the condition for everyone, but it's worth trying it for a month or two and seeing if it makes a difference for you. These fish oils or other omega-3 oils also may have some benefits to things like heart health and joint health and things like that. So it doesn't hurt to give it a try, as long as it's something that won't interact with any of your medications. You would want to check with your doctor about that. Certain blood clotting medications, you might want to not use fish oils. But I think it's worth a try for a lot of people to see if it helps. Another thing with blepharitis that you got to think about is that you can have kind of an ongoing mild level of symptoms in the background that just causes some of the irritation or dry eye type symptoms, but then sometimes it can really act up and become more of a localized, more significant infection like a sty, where you get an inflamed oil gland that fills up and with like a little pus material, and it looks kind of like a pimple on your eye. And people who have this ongoing blepharitis are definitely more at risk for developing recurrent styes. But even when your eye isn't having those more severe inflammations, people who have chronic blepharitis tend to be more at risk for just ocular irritation, dryness, transient blurring of vision where it seems like you have to keep blinking to clear up your eyes. And so it is something that even when the main symptoms are over, where you feel like you're doing well, it doesn't hurt to keep using these warm compresses and lid massage, or the cleansing sprays or things like that on an ongoing basis to help prevent further recurrences.